And thanks so much for joining us today. As you would have just seen the prompt come up, we are going to be recording with plans to put this up on our YouTube channel, where you can find other recordings of past webinars as well. So very excited to be with you here today. I say that on every webinar, and I mean it every time I say it. I think we're going to have a great hour together. As Nairi posted in the chat, we would so love if you would put your name, organization, location in the chat so we know where you're joining from today. And as we go, feel free to put any questions or comments, juicy insights that you have into the chat. We will be reading them, hopefully responding. And if there's time at the end, which we have planned for, we will do our best to answer some of those questions. So today you're going to hear from 5 of us about how shifts in procurement practices can allow your organizational values to show up in how you spend. We're going to present for, like I said, about 60 minutes together, and each of us will introduce ourselves when our time to speak comes up. For folks who are on the call and are part of our Planetary Health community of practice, we're going to have an opportunity for 30 minutes after the call to meet and bounce ideas off each other and ask more questions of our co-presenters today. And I will do my best to make that point very obvious, so you'll know if it's time to sign off or to stay on the call. If you are joining from an organization that hasn't yet joined our community of practice, just a pitch that we would welcome you with open arms. We are a group of healthcare leaders and members of food service teams who have similar goals of reducing the climate impact of food. We meet together about once every 2 months, and we learn and make change and do what we can to support each other. So I'm now going to pass it over to Hayley, who will share about the opportunity that we have to leverage healthcare's $4 billion a year spend. And extra thanks to her because she is filling in at last minute. So much appreciated, Hayley. Thanks.
Thanks, Amy. Well, I mean, it's a real test, right? If I can't set up a webinar for our organization 9 years in, I think I better step aside. But yeah, I'm so happy to be here. I'm Hayley Lapalme, and I'm based now in Victoria. And so coming to you from traditional and unceded territories of the Lekwungen speaking peoples. And specifically, I am in a neighborhood that is under a big kind of like rocky hill with a beautiful outlook over the ocean that is specifically the traditional territory of the Songhees. So really grateful to be joining from here today and joining to talk about something that has been a passion and interest of mine ever since I realized how important this $4 billion opportunity in the healthcare sector and more broadly in the public sector was in terms of transforming food systems. So most of you are probably familiar with our work at Nourish. We're a national, sometimes I say leadership program, community of practice. Some people ask us if we're a lab, we're an incubator, but basically we're a place where healthcare leaders, food service, community organization, policymakers come to explore good ideas about how we build the future in a future in food and health systems that is regenerative and health giving. And so today we're looking at one of these most powerful leverage points for creating the sustainable future that we imagine of these regenerative food and health systems: public procurement. And it's something that is, you've probably by now heard over the years, it's in the water, this idea of $4 billion. And it's something that is probably sometimes feels hard to operationalize. Like, okay, how do we leverage this spend? And so that's what we're here to learn about today and talk about an exchange in this community of practice from some really wonderful folks who have been in this field and leading this work and mentored me for many, many years. And so we'll be looking at this question about how do we move from lowest cost to best value to really unlock that full power of food. So if you are new to Nourish, I've talked a little bit about it, but just to reiterate, our mission is to empower healthcare to embrace food as medicine, to advance health equity, climate action, and community well-being. And so, as many of you will know, our current food system generates poor outcomes for human and planetary health. We see this in terms of the degradation of soil and water. And I was recently speaking with an Indigenous physician, Dr. Shannon Waters, in up on Lake Cowichan here in British Columbia. And she was talking about the metric of a governance body there around the Cowichan waterway being that they would like to be able to get to a place where they can restore the health of that ecosystem such that they would be able to eat the shellfish from that water again. So if you can imagine a historical relationship with water and land, and now the food that you have grown up and that ancestrally you have eaten is not safe. I remember speaking to peach farmers in the Okanagan 10 years ago, 20 years ago, who didn't want their children to inherit the farms because when they would spray in the orchards, it was so toxic that the workers that would be in the fields would wear the equivalent of hazmat suits, and you couldn't walk in the fields for a few days after the spraying. So we're seeing these pressures, and they're not good for the earth. They're not good for humans, and they both contribute to this issue of an increasingly overburdened health system. So we're working with this growing national community of practice to bring food to a more central place in health and healing, and really activating this anchor leadership, this power of healthcare to focus on building and creating health and well-being in a way that strengthens and honors culture and that fosters climate action. So you're going to be hearing from some fabulous people today, as I said, and they're going to be taking us through a step-by-step approach and strategies for implementing values around food and community and climate action into procurement. So healthcare organizations across the country, we see increasingly, are really taking on this leadership opportunity, making changes in their menus, in their purchasing, building engagement with staff, communicating about it, really building momentum towards outcomes that really go beyond just the bottom line, and that are contributing overall to our well-being. So I want to put this in a little bit of context, and just take a moment to give you all a pat on the back for being here today. Last week, or a few weeks ago, rather, the Lancet Countdown 2024 Climate and Health Policy Priorities for Canada was released. So this is a global annual reporting process that tracks progress on health and climate change. And the Canadian brief is authored by the Canadian Medical Association, the Canadian Nurses Association, and the Canadian Public Health Association. And so they put this out and listed front and center as one of the top 3 priorities, the importance of healthier diets, healthier people, healthier planet, and the importance of using health systems purchasing power to drive a shift towards sustainable plant-rich diets that can help cultivate food security and local sustainable food economies in Canada. And we were delighted when Dr. Courtney Howard, who is one of the authors, reached out and said, unbeknownst to us, hey, there's a nice shout out to Nourish that got included in this report. And just acknowledging the work that has been going on across the country from folks like Wendy and Dan and others you'll hear from today, really to move this work forward in a good way. So I'm just gonna, I think, just land in a place of asking you, as you're listening today, to think about and to remember, especially when there's complexity in this work, because with procurement work, there is never not, to think about, there was a teacher of mine who once, a food systems teacher at the University of Toronto, who would hold up an apple or a piece of fruit, and she would say, if this piece of fruit could talk, what would this apple say? Or what would this tomato say? And so um, whatever it can say, whatever you hear, the whispers of it, keep keep those things in your mind. What do we want the tomatoes and apples this is of the future to be saying to our children and to our children's children? And just remember that when the work does get tricky, you have this amazing resource of folks here to help you on the journey. So with our apples and tomatoes and oranges in a basket, I'll hand it over to Amy so that you can share some of the context about how we started down this journey with Nourish and around values-based procurement and where the implementation guide came from. And then you can set up our speakers a bit more.
Thank you, Hayley. That was really cool. I foresee myself in the future saying, give me a moment, I have to hear what the apples are saying. I really do like that.
Yeah.
For those of you who don't know me, my name is Amy Ford, and I work as the Director of Planetary Health here at Nourish. I had thought to insert some information about like my educational background here, but I think far more interesting is some of the volunteering experiences I've had. So I sit on the board of directors at an urban agriculture nonprofit. I have served and been in leadership at a soup kitchen / street mission / overnight shelter. And I participate in our city's environmental stewardship advisory committee to the city council. And it is in spaces like that that I see there is so much living passion around repairing our food and health systems so that we and our planet and our non-human kin can all thrive together. So that's what excites me about being here today. Enhanced procurement values have always been a really core area of focus for Nourish. And last year, as some of you may know, we were proud to publish this primer that was to support institutions in harnessing their buying power for better health. So the whole plan was to create something that would introduce the topic, get people excited, start a conversation. And I imagine many of you on the call have seen it before. If you haven't, it's available for free to download from our website, and it's in both French and English. And one of my favorite prompts in this resource is asking the reader to look into their organization's mission, vision, and values. So what are those like 3 to 5 punchy headlines that you deemed important enough to put on your public website and like stake your reputation to? And then the second question is, how do those values translate into the way that you buy things? It's a question that's been interesting to me even on a personal level. When I think about how I raise my children and what I think our family stands for, because I want us to be a family that's community-minded and willing to live lightly and to be bold in our pursuit of justice for others. But then how does that look when I'm deciding where to buy my food from? So it's curiosities and reflections like that that made this primer a really good jumping off point on this very cool topic. Several months after the primer's release, we wanted to see how it landed on people. We did a short survey, and through that, we were pleased to find out that 100% of people who downloaded it actually read it, thank goodness. And a good majority, many, if not most, had also shared it with others and taken action because of it. We also found out that it was valuable to everyone, and they had some pretty good thoughts on what they wanted next. So we learned that readers were craving a better understanding of the policy landscape and some advice for common barriers. They asked for information about cultural considerations and for some sample language to use in key procurement activities. We took all of that to heart with our new creation. And we also heard that people really wanted a business case that they could share with their senior leaders to support the cause. And I mean, fortunately enough, we happen to already be partnering with a group called Peach Health. And they, with other co-authors as a group, have recently, I think within the past 2 or 3 weeks, published a business case for sustainable food and healthcare. So that's my official plug to go check that out as well. And then lastly, we were told a downloadable PDF continues to be the preferable format. And so I'm so excited to announce today we are releasing this downloadable PDF format document for everyone's viewing pleasure. In this implementation guide, which is available on our website right now, we've taken into account everything we heard from you that would be helpful so that you could best implement value-based procurement of food in your healthcare setting. You can see from the list here We took great care to provide really practical information that would best equip food service and procurement specialists to put these recommendations into practice. So come with me now on a bit of a tour of some of the sections. The primer had covered a lot of ground in setting the stage for why this work is important, but it certainly doesn't hurt to do a deeper dive into some of the elements like why do we need to lead with relationship, which we'll hear more about today, or why is it important to intentionally build equitable opportunity, especially for smaller producers. The implementation guide does have an opportunity brief that is a nice little like copy and paste share if you wanted to let a colleague know what you're up to. We also touched on some topics that hadn't really been built out too much in the primer, one of which is the major opportunity for enhanced procurement values in cafeteria food. And as we support the work with hospital inpatient, like the patient tray, we can't help but remember that staff wellness is core to a healthy operation. So cafeterias actually experience a little bit more wiggle room with their menus and their ingredient sourcing. And they're a really, really cool space for being able to test innovations and have your values show up front and center, especially before they land on the patient menu. The meat and bones, so to speak, of this resource is a really solid foundation of practical advice, which is exactly what we heard from survey respondents that would be necessary to advance this work. And we included things like suggestions for key procurement activities in various formats. So there could be something short and sweet, like a bulleted list of recommendations, to actual copy and pastable language, like an RFI for the supply of local foods. And then perhaps the most fun of all that I had while co-authoring this resource was pulling some case examples. I think theory can take you far, but actually reading about what happens in real life at real organizations is such a game changer. So we were sure to include real case examples, procurement making tangible benefits to farmers, to healthcare organizations, and even to the residents at a long-term care home. And I'm pleased to say that, again, we were able to be very fortunate and draw wisdom from our past co-authors, Dan Munshaw and Wendy Smith, who have been honestly trailblazers in this work. And they pretty much never say no to an opportunity to support others with a similar mission. We thank them for that. And we also collaborated with Brittany Maguire, who is very well connected in the healthcare world, specifically with organizations that are looking to make these kinds of improvements. So for today, to each of these three, I posed the question, just what's the best thing that we can pass along to our audience today to get them started? I'm going to start by passing it over to Dan, who can introduce himself and share some top tips for success. And as a reminder, do feel free to put comments and questions in the chat. We will try to answer some of that at the end. With that, I'll hand it over to Dan, and he will eventually pass the torch to Wendy and then to Brittany. Thanks.
Excellent. Amy, thank you so much. And I want to say thank you to you and to Nourish for the opportunities that you've presented to me and my organization in terms of advancing local and healthy and culturally responsible foods. We've had many successes, and I'm coming at this from a supply chain professional perspective. I don't work in the food services areas, so the frame of reference I'm coming at and we'll speak to will be one of procurement. And what I tell people is you can't prepare and serve what you can't source. And so that's the heart of procurement is you need to be able to obtain the product in a sustainable manner, in a consistent manner, and at an affordable price. And so I'm going to build on what Amy was speaking about, which was stories. There's the technical part about it, but I think a lot of the power comes from storytelling, and that's where there's a lot of messaging. I was presenting at a procurement workshop probably about 2 months ago, and I was quite concerned over some feedback that I got. I asked the question of the participants, and there was about 100 people, how important is building relationships within the supply chain? And the answer I got back was very surprising. And the answer was low. They felt that building relationships through social media and through electronic means was perfectly suitable. and they didn't really want to get out of their office and interconnect with people. And I was surprised and very disappointed to hear this. So want to speak about the power of relationships, because from a procurement perspective, we'll chat about food, but it doesn't matter. The power of relationships is incredibly important. When I started my food journey, I thought I would be in and out in 2 years. I didn't initially see this as a complex commodity, learn a little bit about this, learn a little bit about this, and then move on to the next commodity. But by getting to know people and listening, it really became evident that food is like an onion. When you peel one layer, it reveals something underneath. In the examples that Amy presented, the gentleman on the left is My Pride Farms, local veal producer. And building the relationships enabled us to get to know Mike and to have a conversation with him about the product that he was producing. Mike generally sold most of his product at food farmers market, and he was quite successful at selling what I'll call prime cuts. These were the prime cuts that were very marketable to higher end purchasers. But he was having a great deal of difficulty moving what I'll call as tier two cuts, the less than prime cuts. And he was building inventory because he couldn't sell it. So we started to have conversations with Mike about how we could introduce his product into our food supply chain and long-term care. And we developed a relationship that started small, testing both of our organizations, and it became very fruitful. And there's more stories, more of the story in the examples that are in there, but just a very heartfelt, wonderful story. And our residents speak about Mike and the product that he produces. The photo on the right has a lot of depth and meaning for me personally. One is in that conversation with Kathy Loon, an Indigenous peer foodie and mentor of mine. She was sharing benefits of Indigenous foods with me. But she was also very pointed and said to me, what are we doing for including Indigenous foods in our menu cycle? We have Indigenous long-term care residents. What were we doing to help them? And I was taken back by the directness of the question. And I had to be honest, my answer was nothing. And through Kathy, we learned the importance that we need to recognize the cultures of the areas that we live in. And I say cultures because it varies depending where you are in Canada. But I took it upon, as a takeaway to learn more about what are the Indigenous foods in our region, and then how do we do it? And it was through that evening conversation, the relationship building with Kathy, that I committed to undertake some heavy lifting to understand this. Now, the reciprocal part of the relationship is maybe a year or two into our relationship. Kathy called me up and said that they had run out of moose. Was there anything that I could do? I happen to know some Indigenous communities, and I reached out to those Indigenous communities who volunteered 500 kilograms of moose, and I was able to get that moose from those Indigenous communities up to Kathy's hospital, so it helped them on the immediate term. I also happen to know one of the past ministers of natural resources, and he was a minister, and I reached out to him to see if there was anything the MNO could do. And they set up a more permanent solution where wild game moose that was confiscated was redirected to the hospital. So met their immediate need, and then I worked to help with Kathy in their hospital to come up with a long-term solution. All of that derived from conversations, exactly what you see right there in front of you, and it benefited both of us. Next slide. once you begin to enter into these relationships, you'll find quite quickly there's opportunities to do business with many of the growers. Not all of the growers, because sometimes what they produce doesn't align well with what your needs are. But within public procurement, for those procurement folks that are participating, you know that we have what I label as rules. Rules are in international trade agreements, we have national rules, we have local rules, and they all tell you things that you can do and what you can't do. A very important part of playing with local and regional and indigenous foods is to understand that within those rules, there is room for creativity. So I call them sandboxes. And the sandboxes are created by thresholds. So at this level of dollar spend or greater, you can't do this, you must do this. But what it also says, at this dollar threshold and under, you can do this and you can do that. So really look at the significance of what the rules are, understand clearly what you can do, and understand clearly what you can't do. And when dealing with local food sources, there is so much that can be done. Photo on the left is a forward food contract that we ended up with a local grower who went and planted and grew carrots on our behalf. And so we have our food services manager. We have a resident. We brought a busload of residents out to the farm per tour. A little tip, do not drive your school bus onto the farm fields. Not a good idea. On the right-hand side, we built a relationship with a local potato grower who, the same thing, we entered into an agreement to buy a large volume of potatoes. But as part of our relationship, the grower asked us questions. What are we doing and how are we converting the potatoes on our production line? And we invited them in, toured our kitchen, and they saw how the potatoes were being cleaned, and they offered, what if we did some custom work for you in terms of pre-preparing the potatoes for use directly right into our production line. And so they were creating 20-pound bags of pre-washed, pre-cleaned potatoes that we could just introduce right in line. They also expanded that to sliced potatoes. So it's that relationship, and it's managing contracts and having conversations that enable you to not only initiate the agreement, but to add so much creative value to the agreements. And the value could be in terms of the packaging. 20-pound bags was suitable for us. They provided some return monies back for marketing, and then we provided them with product for composting. So these were just added win-win-win elements that we were able to achieve with our local growers. Amy, I think that's it for me.
Thank you, Dan. I'm going to pass it over to Wendy.
Good afternoon. My name is Wendy Smith. I currently am a sourcing manager with Mohawk MedBuy's Meal Source, a nonprofit group purchasing organization. We service hospitals and student nutrition in Ontario, and in the province of PEI, we service hospitals, corrections, and long-term care. So I have been working with Nourish since 2016. I currently live, work, and play about 40 minutes from Six Nations of the Grand River. Over the 32-year career so far, I have learned that we have to stop racing to the bottom with food. And I've also learned in my frontline years that making a change to a healthcare menu is very challenging. So when Amy asked what are the tips I could give to help people get started, I came up with two. So first, incremental steps. So personal promise to improve the menu over time. My colleague Kelly Brooks at St. Joe's Hamilton and her team decided one item a quarter. And I think that's brilliant. So consult your contract schedule, make a promise within your team, make a concerted effort to say, you know, what menu item is not working, what change would we like to see, and then actively seek better. that would be my recommendation. And if you do it incrementally rather than, oh my goodness, we need to change this whole menu, you'll have consistent wins, you'll build morale, and you'll be doing it at a pace that everyone can get on board. You know, and in deciding what that item is, if you look at the things I jotted down in my thoughts, you know, consulting your tray audits, do a small waste audit on a menu item that you think is not very successful or popular, and maybe start there. Networking and collaborating. You know, one of the things in the meal source group is we meet monthly, and members get the opportunity to talk to each other and compare notes, and also say, hey, I found this great product. So, you know, you're not alone in this work. There's a lot of people looking in the same direction, and really lean in on your peers, and there's no need to reinvent the wheel. And of course, it's always good if you can hit a lot of marks with, you know, a lot of wins with one change. So if you find something cost neutral or cheaper, you find something better for the environment, you find something better for your patients, more palatable, supporting your local food system. You know, all the Greenbelt work we did in the past, they did a ton of research, and I think they landed on between $4 and $7 for every dollar we spend on local food. So if you think about that in your community, you know, say $5, every dollar you spend is $5 in the local economy where you live, work, and play. And when we go back to Dan's thoughts on thresholds, there's a lot of space for that work. There's a lot of space for to find those benefits in your community. Next slide. Off-contract spend is a very easy way to start to move this stuff. So obviously you can work with your contract provider to make big wins as a team, as a group, as a GPO. But in your house, you can do little things. You can find, perhaps there's a restaurant in town who makes a fabulous side dish, entree, and niche item. You could think seasonally. You can think for a holiday menu. You could think in your cafeteria or regularly on the patient menu. Like what if you engage with your local food system, you'll find lots of opportunities to bring that in-house. And I know that we all do it personally. It would be really nice to see us all doing it professionally as well. Produce is a huge opportunity. I don't know of any group purchasing organizations who contract produce, which means that most organizations are running their own process or using a 3-quote system, depending on how much you spend. So who are you getting those quotes from? And what kind of demands are you making? Are you actively asking for local sustainable produce? Or are you just giving them a list of the kinds of produce you want and receiving whatever they offer? You know, so if you're using a 3-quote system, those 3 quotes can be from anyone. So take a look at who you're asking for those quotes. Is it broadline distribution? Are you getting California produce on the regular? Yes, it's consistent. Yes, it's it hits your marks, but is it best for people and planet? And those are the kind of questions that would be great to start asking. And you know, there's fabulous opportunities for partnerships with growers and producers in your area to serve you directly, if that's something that you're in a position to do. I know that a hospital in downtown Toronto would have a hard time with getting another truck to the dock, but many of us can do that kind of thing. And finally, I would suggest that you look at the legislation that governs what you do in your region, because there's lots of legislation provincially in many provinces in Canada trying to support the local food system. Does it have as much teeth as we'd like it to have? No, we have trade agreements, and it's a delicate tightrope that they're walking, but they do want to support you in this work. They do understand that agri-food is vital to the economy, to our sovereignty, to many things around a successful country. No empire ever survived that couldn't feed itself. And we have a responsibility as anchors in this work, using tax dollars for good, to ensure that we have a diverse supply chain in our healthcare institutions. And now I will pass it to Brittany.
Hi, everyone, and nice to see you all here today. My name is Brittany Maguire. I'm the Managing Director of the Collaborative Center for Climate, Health, and Sustainable Care here at the University of Toronto. I'm also the Sustainable Procurement Lead for CASCADES. The Collaborative Center is a for-faculty initiative of the University of Toronto. It's a new academic unit. It's a partnership between public health, medicine, nursing, and pharmacy, and we launched in November of last year. Today, I'm going to talk about the power and possibilities of leveraging a network through giving some examples of our sustainable health system community of practice. Well, what I'm going to talk about is not specific to food or food procurement. I think that there's some lessons to learn here from the work that we've done over the last few years. The community of practice launched in 2020. It is a partnership between the Council of Health Sciences at the University of Toronto and the Toronto Academic Health Science Network, or TASN, which is the 14 academic hospitals that are affiliated with the University of Toronto in Toronto and Mississauga. It was formed in order to address the challenge of climate change and sustainability within the health sector. Our work is guided by a leadership table that has senior leadership representation from each of the 14 hospitals that are affiliated. And it also reports to the TASN CEOs multiple times a year. I'm saying this because I think the structure has actually really been important for the success of our work. So I'm going to focus on a few stories, if you could go to the next slide, to kind of illustrate some lessons that we've learned over the last few years. So the first one that I'm going to highlight is one of the first areas that the community of practice really started in, which is the operating rooms. So we identified this as a high priority area of interest, both in terms of impact, but also because of clinician engagement and really keenness to work in this area. So that's what emerged as a top priority early on in our work. We identified 10 top items or actions that you could take in the operating room on sustainability to create a scorecard, which helps to really focus the attention on the most high impact and achievable actions that you could take. So really distilling down from literature, from recommendations, and active consultation with clinicians from the 11 hospitals within TASN that has an operating room in order to identify this scorecard, which we've then done 3 iterations of. Each year, the operating rooms score themselves. The leaders who engage with us on our working group score themselves, and then we communicate the results back out to their teams, to the leadership table that guides the community of practice, and to the chiefs of surgery and anesthesia, as well as the CEOs. And I think this reporting structure is really important because we're sharing not only with the teams and the ones that are actually going to make the change, but also reporting up to the people that can enable new resources to help move on some of these items that are going to be concerned with, the reputation of their organization, how they're comparing to their peers, and will be motivated to change. So some of the CEOs, when they've found out some of the results on their scorecard and how they're faring in comparison to the peers, were really motivated to try to make some change and to mobilize supports for those clinicians that are really engaged in our working group. I also think that this experience highlights the value of people coming together regularly. So we have a working group and they meet monthly, bi-monthly, depending on the time of year, to talk about their own progress on their scorecard within the year before we report back out once a year. So they're troubleshooting, they're talking about new workarounds, they're talking about how they were able to make change within their organizations and really helping each other work through it. And sometimes bringing forward an example of what another organization has been able to do allows you to be able to take that forward in your organization and say, actually, this isn't impossible, and this is how it's happened somewhere else. So I think that those are a couple of key lessons from that work. Could you go to the next slide, please? Another priority area for our community of practice has been sustainable procurement. And we weren't really sure how to tackle this issue at first. All of the procurement is organized differently depending on the different 14 organizations. Some have procurement leads and directors, some have chief financial officers, some are with some group purchasing organizations, some are not. So we were struggling with how to approach this. And what we did is we formed a working group with those most interested in this work, chief financial officers and procurement leads from across TASN, to start talking about how do we move forward on this. The result is that it led to an event that engaged all the CFOs, or almost all the CFOs from across TASN, where we brought everybody together at a time that they were all available. So we planned months and ahead of time. And we shared examples of sustainable procurement work from within TASN. So demonstrating work that is ongoing or had been completing from within the network. And I think really important to this is that the meeting was devised and also chaired by CFOs from within our working group. So they were chairing a meeting of their peers to talk about this. And we brought forward, motivating information about why this is such an important lever, which we've heard about from Hayley's presentation today. So why is procurement such an important lever to create change, as well as practical examples. And this led to a TASN commitment or statement of commitment on sustainable procurement, which has been endorsed by all of the organizations. And I don't think I would have imagined that that could have been a possible outcome from just an event highlighting examples, but I think it really shows how bringing people together and allowing dialogue and making space for that, and also having someone internal champion the work really can lead to new and exciting possibilities that you wouldn't have imagined otherwise. As a result of this statement, then the working group came back together and started talking about how do we actually now do something with this? Like, it's good to have a statement, but how do we put it into action? At the same time, our Sustainable Operating Room Working Group that I had been talking about before had been deciding that their collective priority was reusable surgical gowns, but they had been facing all sorts of internal barriers on moving forward with that. And so we decided to bring that priority from that working group to our other working group on sustainable procurement to help troubleshoot and work through this, which has now opened up new doors and possibilities. And as a result, we're in the midst right now going towards wrapping up on a multi-hospital pilot of reusable textiles. So not just surgical gowns, but also isolation gowns and drapes at 4 TASN hospitals. And we're going to be using that experience and those lessons learned, some troubleshooting that has happened, to bring forward recommendations to the larger group of 14 hospitals to explore, how can we move forward on not only reusable gowns, but also other textiles and maybe other reusable items. So I think, again, collaborative projects, I think they have the possibility to encourage organizations to endeavor to try something that they might not otherwise because they didn't know it was possible, or it takes a lot of administrative and supports and other resources to try something new. And you're not reinventing the wheel all over again. You really can lean on each other for some of the internal things, like even surveys or posters or communication materials, and troubleshoot them at each of the organizations and move forward together. So we have this pilot right now on surgical reusable textiles, as well as another project on reducing unnecessary glove use, which is going through a similar process. Could you turn to the next slide, please? So I'm going to tell one last story about our work. So we have been developing a sustainability balance scorecard for TASN. This scorecard was created to streamline the set of sustainability opportunities and objectives that you could go after within organizations and agree upon the top priorities for the TASN network. So there's, endless things that you could do within an organization, but we went through the process of extensive consultation and iteratively developing a scorecard that really lands on the top 8 items of priority, as well as process indicators that we have all agreed on as the 14 organizations are the way in which to evaluate our progress on these metrics. So I think it's actually a really exciting project, and it's a really exciting feat that we've got there to agreement on all of the scorecard that they're now reporting on and will be reporting on annually to compare progress and how they're doing on each item, but also to share lessons, to share successes, so that we can be facilitating knowledge sharing and resources and the actions that are available within our network, and not going it alone on each of these items. So really deciding that these are the top priorities for the network of 14 hospitals allows us to move together on some of these things. Of course, there might be work, and there is work that's happening that's not covered by the scorecard, but at least we know that there are a top number of items that we can be moving forward on and discussing collectively. And now we're getting into the conversation about how do we mobilize this even more. Maybe we create specific workshops, meetings around each topic within the scorecard. Yeah, so I think an importance of this, or what I'm taking from this example and from the other ones, is really consulting throughout the process of making something like a priority setting document. So like our scorecard or the OR scorecard that I mentioned, consulting with the people who will actually be the ones enacting the change, as well as consulting people who are in charge of the vision and the resources of an organization, so up to senior leadership to make something like this. And I also think we've learned through this process how powerful competition can be. I think that it really helps to drive ambition and to show what's possible. Yeah, so I think that's what I have to share from that example. If we could just go to the next slide. To recap, I think there's threads through all of these examples and through the other work that we do as the community of practice. So like I said, I think engagement with multiple levels within an organization, if you're trying to make change, is really important. Or even sometimes for us, it's been helpful that we as outsiders are able to connect people within an organization that have a shared interest in sustainability, but some might be clinicians or senior leaders and they just haven't had a chance to engage before. And so sometimes that helps to open those doors. And sometimes reporting up on your actions to senior leadership can help mobilize resources or open doors that you didn't know could be opened. I think, as I said, consultation throughout the process of developing something and iterative development is really helpful. I think it makes sure that the work that you're doing is grounded in organizational realities and brings everybody on board so that when you go to mobilize and actually roll something out, you have a lot of people behind you. As I said before, I think we've noticed that common priority setting, scoring, and reporting has really allowed us to move as a collective on some items, because I do think that competition and encouraging ambition really helps. This also enables champions to push internally on work. So we've noticed that some sustainability champions within hospitals might not have had a tool before to say, these are the top priorities that we should be working on as an organization. And I think they're able to use the multiple types of scorecards that we have to really say, no, this has been identified as a top priority across TASN, or sustainable procurement has a commitment across TASN. So can we actually do something on this? And I think that that's been helpful, or at least that's what we've heard. We've also heard from some people that have reported on our balanced scorecard for the first time recently that it has been a helpful tool to connect people internally that otherwise wouldn't have had an opportunity or a reason to connect before. So someone in buildings or facilities that's passionate about sustainability, and someone who's in clinical care connecting on sustainability. And again, I think that the sharing of examples and knowledge really demonstrates what's possible and reduces the work for individual organizations. And obviously, we support with a coordinating capacity that I think is helpful. But even hospitals sharing amongst each other what they've done really reduces some of the burden for each individual organization. Thank you.
Oh my gosh, thank you, Brittany. That was full of incredible advice. And I will tell you, it is rare that I get excited about something that's not related to food, but I'm legitimately so amped up about the reusable textiles. So thanks for sharing that. I want to thank actually all of the presenters today. So amazing that you took time to share with us. And I'm just looking at the time to see if we will be able to do some questions. I will say what you heard from today was just a tasting menu of what is available in the implementation guide. So it's our sincere hope that you download it, read it, share it, use it. And I'd challenge you, if you enjoy the content, to share it with a peer and follow up with them to see what sort of action it could lead to at your organization. On our newly renewed website at nourishleadership.ca, we have a knowledge hub where you can filter to things that are just related to procurement or to other topics that you enjoy. So that's where you'll find this. And I think maybe Nairi can put the link in the chat. If you are ever feeling stuck on your values-based procurement journey, or you want to be connected with like-minded peers, or you have suggestions for where this work should go next, please do reach out. We have obviously the email address contact on there. We'd love to hear from you. And I'll mention there are a world of resources out there. I talked about the original procurement resource that we made, the primer. We also have the sustainable menu guide, which supports teams to make their best menu planning decisions for sustainability. And earlier I mentioned that Peach just released their business case for sustainable healthcare food. It's a great read, and I truly hope that it can land on the desk or the inbox of senior leaders all across from coast to coast to coast. And lastly, Nourish recently contributed to CASCADES Playbook for Food Infrastructures for Planetary Health. It's a great read, and so I would highly recommend that you check it out as well. As I mentioned, this recording is going to go on our YouTube channel where there's other great content. We would love to connect with you on LinkedIn or Instagram or email. Contact information is on our website. And I am going to be sending a short feedback survey after today just to see what more you would like from what we are offering. So right now we have time for, I'm going to call it one question. If anyone wants to use the raise hand feature, I think we've got time just to ask our co-presenters one question.
And Amy, perhaps we can also invite folks if they want to chat a question in, we can use those questions, we can follow up with those questions as well.
If we don't have an immediate question, and I'll keep looking at the chat, I have a question maybe for Dan or Wendy. What is the most exciting new food product you've seen on the market in the past 2 or 3 years?
Go ahead, Dan.
An area that I've been doing a deeper dive in the last few years, and I just threw a comment in the side chat, is indigenous ingredients for preparation into finished foods. This area is growing. There's a company based out of Northwestern Ontario that is listening and starting to make available product like spruce tips, fresh young spruce tips, bulrush flour, wild rice, and these ingredients were never available before. So Amy, to your point, seeing change in the food supply chain related to supporting indigenous foods probably for me has been very exciting and maybe the most rewarding.
And my answer was the wild rice from Agritech North as well.
Yeah, Wendy and I crossed paths over the same vendor.
And yeah, the proprietors of that organization are incredibly driven to improve the food system in the north, to get northern food down and southern food up. And yeah, I just want to support them in every way I possibly can. It's just such an exciting movement.
And what's the thing you would most like to see that you think your members would jump on, your healthcare colleagues would jump on if it were more available?
Plant-based protein with less than 50 ingredients is certainly would certainly be lovely. Right now, particularly one of your anchor cohorts, Unity, is working on power bowls. But current state, hospitals are used to receiving finished entrees and serving them to patients. And in order to move in a direction of plant-based, that's going to require labor and equipment that many don't have. So yeah, a market that is responding to the need for plant-based protein, you know, that's not full of stuff we don't need and just has what we do need would be very exciting.
How important would food hubs that are doing kind of minimally processed value add, washing, peeling, cutting to support that transition to more in-house production to produce plant-based foods that don't have 50 ingredients, but maybe just a few? How important could that be?
Very, very, yeah.
Supporting with what Wendy's saying, in most institutions, Hayley, we're dealing with unionized staff and who do an excellent job at what they do. But when you factor in the labor costs for food preparation, and if that could be shifted to growers or harvesters who could mechanize that process and provide us with regionally produced foods with more value added, such as the potatoes, I think that would be an incredible win because you would lower your ultimate food preparation cost and support your local growers and support the regional economy, like what Wendy had mentioned on your reinvestment ratio of 4 to 1. That would be an excellent benefit.
And a shift to preserving food at all, right? We ship out raw ingredients and we bring back finished food. That's what we do in this country.
Mm,
And we have to preserve food. We have to start freezing it, canning it, preparing it and processing it, right?
Yeah.
At greater scale, in a way that folks want to see it sustainably and with respect to the workforce you're using. And yeah, that's my dream future. That's what I'm fighting for. And respecting the water, of course. Water is a very important part of this discussion, and soil now.
Beautiful. Okay, well, I'm hearing from the apples of the future, spruce tip tea on hospital menus. I would be beside myself if I was served that.
Mm.
Now it is time to bid goodbye to the larger group, inviting the members of our community of practice to stay on. And I'm going to offer as a gift a 5-minute bio break. If you would need me to run and refresh your beverage or use the washroom, we're going to come back at 5 past the hour. And also we can stop recording, and I'll see most of you folks in just a minute.